Testosterone replacement therapy is booming. Anabolic steroids, booming. But the million-dollar question is, can you be on TRT while preserving your fertility? I'm Dr. Justin Houman, board-certified urologist and men's health specialist, here to talk to you about the myths, the facts, and everything you need to know about testosterone replacement therapy and fertility. Spoiler alert, it's a lot more complicated than you think. Why do men get on testosterone replacement therapy in the first place? When you have low testosterone, you have issues like fatigue, poor sleep, mood issues, anxiety, depression, not getting the exercise benefits like you used to. All of these things, including your libido and sexual function, can throw you off your game and not make you feel like you were when you were in your early 20s. We know now that men starting at the age of 30, their testosterone levels slowly start to decline about 1% every year. And these issues, when it comes to sexual performance, libido, exercise performance, mood, anxiety, all of these things can negatively impact it as a result of that. For some men, that impact is in their early 30s when they're still in that fertility range. Other times it's for men in their 50s and 60s when they're way outside that fertility window. So for men in their early 30s, when they're still in that fertility window and they want to boost their testosterone levels, unfortunately, many of them resort to testosterone replacement therapy. And the reason why I say it's unfortunate is because a lot of these men don't know the fertility consequences of being on testosterone replacement therapy. What testosterone replacement therapy does is it shuts down your testicles' ability to produce two things, testosterone and sperm. And again, most men don't know this because a lot of doctors outside of men's health specialists like myself aren't versed enough to tell patients that testosterone replacement therapy can shut down the testicles' natural ability to produce sperm. So many times patients come in having been on testosterone replacement therapy for 2-3 years. They've been trying to conceive with their partners for months on end. And when we check their semen analysis, their sperm is at 0, not knowing that they didn't know that testosterone replacement therapy is the problem. What does the data show? We now know that testosterone replacement therapy can reduce your sperm counts to essentially 0 for about 75% of men within 3 months. And we know that once you come off testosterone replacement therapy, for some men, it takes anywhere from 6 to 12 months to improve their sperm counts, or at least get their sperm counts back to those normal levels, which is a significant amount of time. Therefore, I always try to educate patients early on what the risks are with testosterone replacement therapy, especially for men in that fertility window when they're trying to conceive sometime now or down the road. So in simple terms, yes, testosterone replacement therapy is a contraceptive. Anabolic steroids, even more of a contraceptive. The higher the dose of the testosterone you're on, or the anabolic steroids, the more severe the suppression is of your body's natural ability to produce sperm. A lot of guys then ask me, can I have high testosterone levels while preserving my fertility? The answer is yes, but it does not have to be in the form of testosterone replacement therapy with injections, creams, pills. We want to avoid those, especially for men in that fertility window. So what do we talk about for them? We talk about a number of things. Number one, Clomiphene or Enclomiphene. These are what we call selective estrogen receptor modulators. In simple terms, what they do is they trick the brain, a specific part of the brain called the pituitary gland, to produce more luteinizing hormone and follicle stimulating hormone. These are two hormones that are involved in the interplay of natural testosterone production in the body. When you produce more luteinizing hormone, it tells your testicles to produce more natural testosterone while preserving your fertility. Therefore, you have higher testosterone levels while preserving your fertility. HCG is the other one. HCG is what we call an analog of luteinizing hormone. So we hijack the system in order to think that the body's producing more luteinizing hormone, therefore the testicles are producing more testosterone or higher testosterone levels while again preserving your testicular function. This is very, very important for young men who are trying to achieve both of having those higher testosterone levels while preserving normal fertility potential. I generally tell patients it can take anywhere from 4 to 6 months to achieve that. During those 4 to 6 months, you're not going to feel like you did when you were on testosterone replacement therapy. There's no question about it. But we try to get you as close to that level that you were. And the only thing I tell you guys is I try to say be patient during this time, because it could take anywhere from 4 to 6 months, sometimes as long as 8 months in order to get there, in order to start having sperm back in your ejaculate. So it does take time. Be patient throughout the way. Some things to remember. Testosterone replacement therapy and anabolic steroids definitely suppress your fertility. If you're interested in having kids, whether it's now or sometime down the road, testosterone replacement therapy may not be the best bet for you if you are having low testosterone symptoms or low testosterone levels. Medications like Clomiphene or Enclomiphene or HCG, all of these can help you achieve those higher testosterone levels while also preserving your fertility. If testosterone replacement therapy is what you want to proceed with rather than these medications I just described, then what I would recommend doing is banking your sperm. But ultimately, all of this needs to be done by seeing a men's health urologist who could discuss all these different options with you and help you navigate through the process. TRT and anabolic steroids can make you feel amazing, but it does come with the trade-off of losing your fertility. Be aware of this, make the smart decision. I'm Dr. Justin Houman. Follow along for more evidence-based information on testosterone and men's health.